Okay, well, I'd like to say thank you for being here and welcome. As you all know, the COVID-19 pandemic has been an unprecedented event as far as Canada, the countries in the world are concerned. And the responses by the governments to COVID-19 has been unprecedented as well. And one of the consequences of that is a large number of people, at least that I've heard from, want to see an independent, national, citizen-led inquiry into what went right, what went wrong, and most importantly for the future, what lessons can be learned from how this was managed that would be ensure better management in the future. So the purpose of this conference this morning is to announce that an inquiry of that kind is being organized, national, independent, citizen-led inquiry into Canada's response to COVID-19. The organization behind this at this stage is we've incorporated a not-for-profit company called Citizens Inquiry Canada. It's a not-for-profit company that will receive donations to support this effort's going to cost some money to receive the money and to spend it and to direct the operation at the beginning. There's also, and more importantly, a website's been set up, National Citizens Inquiry.ca, where people are being invited to indicate their support, that they want such an inquiry. Secondly, to suggest the names of commissioners that they would have confidence in, because this inquiry would be conducted by commissioners. And thirdly, to donate if they wish, because there's going to have to be some money raised in this connection. So, and the plan is to keep that website open for November and December to endeavor to get support for this concept of the inquiry and get these suggestions for commissioners, but to then hold public hearings across the country starting in the new year. The initial idea is that there'd be one in Atlantic Canada, probably centered in Moncton, one in Quebec, in Montreal, one in Ontario, in Toronto, one in Manitoba, in Winnipeg, one in Red Deer for Saskatchewan, Alberta, one in Victoria for BC, and then concluding with a summary hearing in Ottawa. And the commissioners would be expected to produce a report shortly after that. These hearings would be in-person hearings and with opportunity for virtual participation as well. So that's really the plan. And as I say, the purpose of this news conference this morning is just to announce the organization of that inquiry and to direct people particularly to that website, because that's where the information will be on who is supporting this, what are their suggestions for who they would trust as commissioners, and the progress of this thing will basically be recorded by viewing that website. So that's probably enough from me, but I'm happy to answer questions about this. I should mention also that in mid-October, a public opinion survey was done that indicated 74% of Canadians felt that harm was done to them by the health protection measures adopted with respect to COVID-19. This is not harm from COVID. This is harm from the protection measures. Those were in four categories: harms to people's health, people on the waiting lines, for example, people that suffered adverse effects from vaccines and so forth, harms due to restrictions of rights and freedoms, social harms, mainly due to social distancing, and of course economic harms due to the lockdown of the economy. And that survey, including regional breakdowns on it, is on that website as well for people that want to take a look at that. Anyway, that's enough from me. Yeah, a question.
From Les Coop de l'Information. Nice to see you again, Mr. Manning. Usually a public inquiry, the strength of it is that they have a legislative power to compel testimony, to make sure that those who know actually give a testimony, which you wouldn't have with a citizen-led commission. So how do you ensure the credibility of the process if you can't ensure that those who know will actually appear?
No, that's a good question. We looked at that, of course. Normally on issues like this, like you're suggesting, the inquiry would be held under the Public Inquiries Act, either the federal one or the provincial ones, where the commissioners would have the power to compel witnesses to appear. And this inquiry doesn't have that. Now, the reason for doing this as a citizen-led inquiry is because so many people are suspicious that if the government commissions an inquiry to look into how the government handled things, that would be biased. So the idea was to try to make this thing a citizen-led inquiry. It will not have the powers to compel witnesses to appear, although it can invite them to appear and publicly invite them to appear. And when they say they won't, if that's what they say, it does raise the question, how come? What have you got to hide? But that is one of the challenges of holding this inquiry as basically a citizen-led one, not a government-sanctioned one.
But again, I ask my question. So don't you open the door of people criticizing that initiative as being something like which will be led by conspiracy theories and people, you know, have this aversion of institution, etc.?
Yeah. Oh, yeah. And there'll be those accusations. But the way to answer that question is not like academically for me to say, no, it's not going to happen that way. The thing is to actually see the hearing. And then make a judgment after the hearing, after you've seen who the testimony is from, the cross-examination. And the intent is to have people testify as to the impacts of this, the COVID protection measures at these hearings. And anyone that testifies, even if someone wants to testify that this group's information is misinformation, but they'll have to testify under oath. There'll be a commissioner of oaths asking that what you say is that you swear that it's the truth, not just the truth, the whole truth, and nothing but the truth. And secondly, you will be subject to cross-examination by somebody who probably knows more about this than you or me. So these are a couple of measures to try to ensure the integrity of this process. But in the end of the day, people have to judge, is this a fair objective exercise, or is it skewed one way or the other? Yeah, go ahead. Oh, okay. I was looking the wrong way.
Hi, Mr. Manning. Stephanie Levitz, the Toronto Star. Who will get to decide who the commissioners are? That would be a lot of power. I mean, I understand that people get to recommend who they'd like, but who's the person who ultimately gets to decide who the...
Well, right now, the organization behind this is this this National Inquiry Canada, which is this federal not-for-profit corporation with 3 directors, of which I am one. But the hope is to add to this group that will organize this thing so it's broader and more representative than us. But that group will decide. But they'll have to base it on what people themselves say is who would they trust to do this. And at this stage, we don't know what those suggestions will be. At this point, some people have suggested what you want is the most objective people you can get, like a retired judge or somebody. Others have suggested, this is typical of Canada, what you want is expertise on that panel. You want a medical person, you want a civil rights person, you want an economist, and so forth. I think what may end up is a combination of those, probably with a chief commissioner whose main characteristic is objectivity and so forth, but others on that panel that have that expertise. And then, as I said to the earlier question, people will just have to judge, is this a legitimate panel in which they have competence? If they don't, then they won't pay attention to it. If they do, then they will.
This seems a few months back now. You were talking, if I recall correctly, about the need for a citizens' commission in general, about the government, about how our country functions. And that sort of followed through a few years prior. You were talking about how the country needs a pop-off valve for all the populist anger that is out there right now. And I mean, do you fundamentally think that something is broken in our existing institutions right now, that people no longer have faith?
That's a broader question, but I'd be happy to answer on some other occasion. I don't want to, this is not so much connected to that, or this inquiry is an inquiry into one particular response by governments to a particular crisis. I'd be happy on another occasion to get into the broader subject of the need for reform, but I think you've heard me on that subject before. But this is a sort of a narrower inquiry just into the responses to the COVID-19 pandemic.
Hi, Mr. Manning. Stephanie Taylor with the Canadian Press.
Yep.
Who are the must-haves in terms of witnesses that would testify at this? I understand it sounds like this is very early stage, we're just putting things together, but if you can't compel people to come and testify or to speak to some of the decisions made at the inquiry, it raises some questions about the process. So in your mind, who would this inquiry have to hear from?
Well, I think the largest group is people who were impacted by these measures. What this public opinion survey shows that 74% of Canadians said they were injured, they were harmed by the health protection measures to cope with COVID-19. So people to testify as to what were those harms, what were the effects on the adverse effects on their health, what were the effects on rights and freedoms, what was the effect on their social well-being, what were the effects on their economic well-being. I would expect a fair amount of the testimony will be from those people, and they'll be subject to cross-examination too, so you don't just take the comments at face value. I think a second type of witness will be scientists and medical people who have an alternative narrative to the one that was put forward by the government. There's a lot of those people. And then the third category, which I think you're getting at, it would be nice to get a response from some of the government people and officials themselves. You can't compel those people to participate, but you can invite them. And it was maybe encouraging the other day that Dr. Tam said that the government would welcome an inquiry into how this was done. So maybe there'll be a more positive response there than we expect.
The federal Conservatives under the new leader have focused a lot on the cost of living, a lot on affordability, some concerns about the ArriveCan app, about the IRGC. But in terms of the effects of COVID mandates and some of the civil rights concerns that people have expressed, they haven't, to my knowledge, been super vocal as of late on those issues. What do you make of that? Should this be something the federal Conservatives take on champion?
Well, we're trying to make this less political, less partisan political than, what does one party think or what does one party do? And partly because, again, the suspicion from the public, if the government took the initiative on this, if the Liberal government took the initiative, people would say this will be a whitewash. If the opposition gets too militant on it, they'll say, well, this is a witch hunt. So it's best to keep the parties not directly involved. I mean, they can choose to be or not, but it's best to keep them not. And to hopefully the representation on that website will be cross-partisan, not particularly skewed one way or the other. And again, like we could discuss this academically and theoretically today, at the end of the day, people are going to have to look at these hearings and make a judgment. Is this objective? Was this a worthwhile effort? Or was it skewed one way politically or skewed another way from the standpoint of interest groups?
Hi there, Matthew Hort from the Western Standard. Good to see you.
Yeah.
You mentioned briefly that there would be talk about adverse reactions to vaccines. I've certainly heard from a lot of Canadians that have experienced that, but there hasn't been much attention given to it. Could you provide more details on what exactly you'd like to see? Would these be individual Canadians harmed by vaccines testifying? Would these be groups on behalf of them? What sort of details can you provide on that?
Well, one thing on this website, one of the background items is that there was a group in Toronto in June that conducted a sort of a test hearing. What would happen if you had public hearings for 3 days? They had 60 different people testify, most of them for 10 minutes, on what the effects were on them. Those testimonies covered quite a range. It wasn't just negative health impacts. It was the rights and freedoms, the social, economic. But the ones that did testify on the health impacts, there were two categories. One was from people that felt that the lengthening of the waiting lines were people suffering from something other than COVID, people that had people die on the waiting lines because of our incapacity of our system to handle a surge in demand, that was a negative health impact as a result of the COVID restrictions. And then others were on the subject of adverse effects from the vaccines. But I would think from what we've seen thus far, those are probably the two types of testimonies with respect to health impacts, and we'll see what they are.
Mm. Would you have any Canadians testify who have relatives or friends that passed away from vaccines? There's one gentleman in particular, his son, Sean Hartman, passed away a couple days after getting the vaccine. He got it in order to play hockey, and he's been quite outspoken on social media about that.
These people be entitled to, our intent is not to sort of try to, first of all, to see who is willing to testify on this sort of thing and about what. But I would expect there would be people that would testify along those lines. And the only caution I give to anybody that wants to testify on this is, A, you will be asked to affirm that what you're saying is the truth, the whole truth, nothing but the truth, which we never had to take that oath in Parliament, but this is another subject. And secondly, that you will be subject to cross-examination. It won't just be accepted. You'll be asked by somebody that's very knowledgeable about your testimony. But hopefully people with these stories will come forward. They certainly did at this Toronto thing, and the videos of those the hearings are available on this as background material on this website.
Great. Thank you.
Yeah.
Me again. Just a quick question. You mentioned that there were 3 directors of your entity. Yeah. What are the 2 others? Who are?
They're listed on that website,
yeah,
but Mr. David Ross, who's a chartered accountant in New Brunswick, and also has quite a reputation for ethics in the accounting business, and an Ottawa lawyer here who did the legal work of putting this thing together, Andrei Litvinenko. Okay. And the names are on the...
Good. I'll check.
There's a brief bio on each of us, yeah.
And the other question I wanted to ask, I don't think we're talking right now of having a real public, like an official public inquiry about this, but if it were to happen, do you think it would be a good replacement of your citizen-led initiative, or you think that both could live side by side?
Well, I think this citizens one would be a good test case to see what would actually happen if you tried to have this inquiry. If the government were to commission, it'd have the same, skepticism that some of you might express with respect to this one. How objective would it be? Governments investigating themselves, particularly on something like that, would that be objective? Would the public say, no, this thing is skewed? There's a real challenge, no matter who does this, to get credibility, and we feel the starting point for that is to ask people themselves, who would you trust to do this, and go with those recommendations.
So you think the two can coexist?
I would think this one would precede. I would think the politicians will watch this one, particularly if it can be done fairly quickly, to see what happens, what comes out, and then that might condition their decision as to whether you have one or not.
Just one more question.
Yeah.
What do you think you would learn from an inquiry like this? Because a lot of these stories of people's feelings about the pandemic restrictions, feeling about the vaccine, experiences with the combination of thereof, they're already out there. You yourself cited a public opinion survey where people's trust in how the pandemic was handled was low. So what new thing would you learn from allowing this kind of airing of grievances, if you will?
Well, I don't want to prejudge the outcome of this, but if I was one of those commissioners, I would listen to these stories. But the last question I would ask a witness is, okay, what would you recommend as to how this could be done differently so that the harm that you've talked to us about wouldn't have occurred? And to try to get on to not just what went wrong, but what can be done differently. And that might be the most useful outcome from this. Then you will get into some of the suggestions that have been made already. Was it the wisest thing to hand the management of this over to the healthcare bureaucracies, when one of the conclusions from the SARS pandemic was that our bureaucracies are not the right people to handle emergency? Is that so? So what's the alternative? What you might get is some of these alternative narratives from the science and medical community who argue that the idea that there's a single scientific narrative with respect to anything is not scientific. Science involves competing hypotheses. So you might get that kind of output, and that would be useful. It's going beyond just what went wrong and what were the harms, but what can be done to try to manage this stuff better in the future.
Just two other questions from me. Who's going to pay for this?
Well, I wish I knew. We've got a donate button on this website, and hopefully, and we'll say to people, it's all very well to click on here and say you want this hearing, but somebody's got to put up the money. One of the hopes is to get a lot of donations in kind, like just the facilities to hold the hearing in a certain town. Will somebody put that up so that we don't have to pay for it? But that's going to be quite a crucial thing. And at this stage, there's this not-for-profit company set up to collect the money and to spend the money. And we'll just have to see whether there's enough financial support to really make it work.
Okay, that brings a bunch of other questions to my head. But you talked about hoping that this would supersede supersede anything that the government might choose to do on its own. Have you gone to the government, anyone in the Liberal government or the opposition parties, and said, what do you think of this? Do you support it? Would you back it?
I haven't, but of course there have been demands from other people suggesting that this should be done. And so far, at least as I understand it, the government has been pretty cool towards it. And for the obvious reason, this is an investigation into something that they themselves did at a profound level. This is an unprecedented intervention. So I think the impression that's been given so far is that the government is reluctant to have this done. Or if it were to do it, it would be skewed in a certain way. Maybe the most recent and most welcome thing was that Dr. Tam did, and some of you, I think, maybe covered that, her comments. She did say that they would welcome an inquiry. It was quite vague, but so maybe the government would be supportive. I don't know. Okay, have we covered the field? Yeah, okay, well, thank you very much. And say, really, that website is the source of ongoing information on this national citizen-led inquiry into the response to COVID-19. So thank you very much.